Some housekeeping things here while I set this up. This is like our third morning one. Usually I was in the middle of the day, sort of. What's going on here? Let's just end that show. So I'm still drinking my coffee, still trying to get through the day, or at least the morning. So, here we go. I promise after this it gets easy. Who's over there, do you know? We're gonna compete. I'm gonna talk louder. Okay. Benefits and payroll stuff. I'll hit the payroll stuff towards the end, but you guys should have 3 packets. The 2025 Benefit Health Guide, and then a packet that says Setting Up Benefits in Kronos Benefit Center. Maybe behind that one, and then one that starts with UKG Dimensions. That is your payroll piece. These are the 3 pieces we are briefly going to summarize today, and it is going to be brief. I know I have 2 hours, but Mark Neal, he is our independent broker for Allstate. He will come in at 10 o'clock and talk about the supplemental voluntary insurance that he has to offer you guys. So that'll be a whole 2 hours, but I have to cover a lot in a little bit of time, so I'm just going to summarize. I am here, however, Monday through Friday, 7 a.m. to 4 p.m. You passed my office when you guys got off the elevator down in the basement. I'm the last office on the right in the HR hallway. You can come and see me anytime. You can email me, you can call me. I am happy to go through all of this one-on-one with you if you want more time, or my job is to thoroughly confuse you, so you do come and see me. Everything you do here at the hospital that isn't departmental specific for you goes through me before it goes anywhere else. So I like to know who I am working with and who's here to enjoy what we have to offer and what you have to provide for the community. All right, first of all, you guys are going to get to do some trivia at the end. I don't know if they've put my questions in yet, but a few, some of the stuff I'm going to tell you today may or may not be on your trivia, so it doesn't mean you have to take notes or memorize it. It's a long day. Keep that in mind. If you're tired of sitting, if you want to get a drink, please feel free to get up, stand at the side, listen, whatever. You guys do have a long day here. A long, fun day. This is the best part. Don't tell anybody beyond me that I said that. Okay. Do we have any PRNs in here today? PRNs? You guys are all full-time or part-time? Yay! You guys are all eligible for benefits. If your spouse is eligible for benefits through his or her employer, they are not eligible to be on our medical plan. Just our medical plan. They can be on any other coverage you choose, not the medical plan though. If they switch a job and they lose medical coverage, that's a life-changing event. You can add them to your plan at that time. All right, let's go. We are going to start on page 3, and I'm going to skip around a little bit, but I'll try to keep you up on the page numbers that I'm on. And again, we're just going to summarize this. We have 3 medical plans here that we offer. We have the core, the basic, and the high deductible health plan. The core plan is what I like to call the cream of the crop. It is our most lucrative plan in that you can see the deductible, and I'm only going to summarize the individual side of this. The individual deductible is $500 a year. Your max out of pocket is $1,500. So what that means is once you meet your deductible, and this is in tier 1, which is the Montrose Regional Health tier, and I'll explain that in a second. But what that means is once you meet your deductible, the plan then pays 90% of a benefit, a covered benefit. You pay 10% until you meet your max out of pocket of $1,500, at which point the plan then covers a covered benefit at 100%. All 3 plans have preventative covered at 100% as long as it's done in network. Tier 2 is the First Health Network. First Health is nationwide, so there's a really good chance that you're gonna fall in the First Health network, even if you're not here in Montrose. So Tier 1, let's go back to that, Montrose Regional Health. We do not have PCPs here, so all of your PCPs out in the community, Cedar Point, Peak, I forgot the name of the other one, they will all fall under Tier 2 and they are in the First Health network. You will be subject to the deductible and copay in the First Health network rather than Montrose Regional Health. But there you will have a copay. So if you go see your PCP, it's a $20 copay for an office visit. It is a $40 copay for a specialist, Western Slope Orthopedics, the cardiology clinic, pulmonology, any of the specialists is a $40 copay on this plan. The copays do not count towards your max out of pocket, so keep that in mind. You do not have to have a referral to see a specialist. Now, I said that. Our plan does not require you to have a referral to see a specialist. The specialist is probably going to require it, so maybe see your PCP first. You're welcome to call any of the specialist's office and let them know you'd like to see them. Maybe you have a bum knee and want them to look at it or something. They're probably going to require a referral. So keep that in mind, even though the plan doesn't, the specialist might. All right, any services that you have done at Montrose Regional Health, which isn't just here in the hospital, in our main facility, it's across the street at our cardiology clinic, it's upstairs at Mountain View Therapy, it's across the other street that way at the wellness, Mountain View Wellness. It's down at the ACC. We have the Alpine Women's Center down there. We also have radiology down there, medical imaging down there now. We have a lab down there, and they just opened the surgery center on the 4th floor down at the ACC. Some of you might work there. I've only actually set 2 of you up thus far, so I'm not sure, but I think some of you do work down there, or will be. Those are all part of Montrose Regional Health. So any service you have done at Montrose Regional Health, if you are on our medical plan, if your dependents are on our medical plan and they have services performed here, you have 30 days from the date you receive your bill to take it upstairs to the customer service window. When you go up to admissions, there's a little hole in the wall. I like to call it the hole in the wall, the window hole in the wall. Her or either of the wonderful reps on either side of her will take your bill and take 50% off what you owe right there. You can either pay your bill in full at your discounted rate or set up a payment plan and they will give you the 50% discount. The most important thing to remember there is you have 30 days from the date you receive your bill. When you go and when you're at admissions or you go get some lab work done or you're any one of our clinics, be sure when you sign in that they set you up for electronic notifications. The mail obviously takes longer. And if you only want paper, that's fine. They can see when your statement was mailed, so they'll know. They'll give you a little leeway on the mail time, but they can see when the statement is generated and mailed. So if it's 45 days, they're gonna be like, the mail didn't take 15 days to get to you, so we're not gonna give the discount. We have to follow some IRS guidelines, which requires us to get a timely payment in order to give the discount, and that's based off our high deductible plan that I'll talk about in a minute. So keep that in mind, 50% off within 30 days of receiving your bill for services provided by Montrose Regional Health or one of our outlying clinics. That does include our radiologists because they are now part of Montrose Regional Health. What that does not include is the surgeon who might come over from Western Slope Orthopedics. They're separate. Or the anesthesiologist who works in the hospital, but they're not part of Montrose Regional Health. They will fall in Tier 2, First Health Network. So you still get a good premium or good rate on a good, still a great benefit. The in-network benefit is still great, but any service you have done here, you are eligible for a 50% discount. Again, you have to be on one of our medical plans though. I am not going to talk about the prescription yet because I have a whole different slide on that. But down at the bottom of the page, you will see your monthly premiums based on your employment status, full-time or part-time. Cut that in half, and that will be your per pay period deduction that I'm gonna take. All right, any questions on that so far? I apologize, I talk fast. I have a lot to say. I want you guys to hear everything I have to say. So if you have questions, don't hesitate to stop me. All right, the second plan we offer is the basic plan. The basic plan is a little bit different. It's got a little higher deductible. It's got an $850 individual deductible, a $4,000 max out of pocket. So once you meet your deductible on this plan, the plan pays 80%. You pay 20% until you meet your max out of pocket, at which point the plan pays 100% of the covered benefits. Again, same thing, Tier 1 is Montrose Regional Health Tier. Tier 2 is your First Health Network. Tier 3 is out of network altogether. So maybe if you're in Florida and you have to go to their emergency room and maybe they're not in the First Health Network, then you still have coverage. It's just a little higher. You fall under Tier 3, the out of network coverage level. You don't have to pick a tier, by the way. All 3 tiers come with all 3 plans. So you just have to pick a plan, not a tier. So don't sit there and go, well, I don't have a PCP at MRH, but I've seen my PCP 4 times a year, whatever. All 3 tiers come with every single plan. So you just have to pick a plan. All 3 plans have the preventative coverage at 100%, as long as you are age eligible. Obviously, your annual physical, there's no age limit. You can get that done at whatever age, pediatrics clear up to geriatrics. You can get your annual physical done, covered at 100%, as long as it's done in network. The age-specific ones are the mammogram. You have to be 40 years old for a mammogram unless you have a history of breast cancer. And then your provider will let EBMS, they're our third-party administrator, your provider will let them know, and then it'll be covered as a wellness for you, a preventative service for you. So it'll be covered at 100%. Your annual colonoscopy is age 45 now. The prostate is age 50 still. We're hoping they'll bring that down. We don't set those guidelines, but we're hoping they'll drop that because there's a lot more prostate cancer out there than we know of. So that is age 50. Those are your age-specific preventative coverages. Otherwise, any age, once a year. Don't do it a month before your 1-year checkup from last year though, or it's not covered. They are specific 1 year to the month. All right, the copays on the basic plan. You have a $30 copay instead of a $20 copay for a PCP and a $60 copay for a specialist. Again, you don't need a referral to see a specialist, but the specialist is probably going to require it. It's kind of a catch-22, like you don't need the referral, but our specialists, the cardiologist, the pulmonologist, the gynecologist, the radiologist, they all require referrals, even though they're they're part of our team. They will require a referral, so keep that in mind. And again, the premiums on the bottom of the page are monthly. Cut those in half based on your employment status, and you will get your per pay period deduction. The basic plan is by far our most utilized plan. I mean, it's still got a great deductible, you still have great coverages, but the premium you can see based on the core, compared to the core, is quite a bit less. So, all right, any questions on that? You guys are easy. Are you guys still waiting? There's juice back there. There's some great looking muffins. I'm gonna have to get one of those. And the only free coffee you're ever gonna get in this hospital, it's not entirely true. I mean, up on the floors they have coffee for the patients, but it's right out this door to the left. So if you need more coffee, perk up, get up, move around, help yourself. I'm gonna take some right now. All right, the last plan I have to talk to you guys about today is a high deductible health plan. The high deductible health plan is exactly what it says. It's a high deductible. There is nothing covered on this plan until you meet your deductible, except the preventative, as long as it's done in network. There is a $3,300 annual deductible. We do not make that number up. This is where the IRS gets involved. They get involved in our high deductible health plans. They set that number for us annually. We have to abide by that. That's where they come in also on the timely payment, because if we're giving you a discount, then it defeats the whole purpose of the high deductible health plan. That's why we have to be stringent on the 30-day discount so that we stay in compliance with the high deductible health plan. All right, a $3,300 individual deductible, a $5,000 max out of pocket. Once you meet your deductible, the plan pays 80%, you pay 20% until you meet your max out of pocket, at which point it is covered at 100%. Again, also still eligible for the 50% discount on the back end. So if you have a $3,300 individual deductible and you show up at the ER, first of all, you're going to tell them that you would like to not pay anything today because you're an employee. They're going to know that when you hand them your proof of insurance card that you're an employee, and then you're going to take advantage of the discount on the back end. So you'd be like, okay, I'm an employee. Can you just see me and I'll deal with this later? And they are happy to do that for us. So you're gonna go in, you're gonna get treated for whatever you show up at the ER for. They're gonna send you home. Just to walk in the door, and do not quote me on these numbers, I make this stuff up. It's gonna be $300 just to sign in at the ER. I don't know what it is, but we'll say it's $300. You have a $3,300 deductible, so you have to pay that $300. Just let them know you're gonna do this on the back end. So you get there, you get your services, you're done. Within 30 days, or whenever you get the bill, within 30 days of receiving your bill, you're gonna take it upstairs to the little window, customer service hole-in-the-wall window, and you're gonna let her know that you would like to take advantage of your 50% discount. So that $3,300 deductible that you have, and that $4,000 bill upstairs in the ER just became a $2,000 bill. You got it cut in half. So not only have you met your deductible, because it's after insurance processes it. So insurance they already said, well, you have a $3,300 deductible, so they're not going to pay anything on that. They're going to pay a portion of the $700 above the deductible to get up to the $4,000. They're going to pay 20%. They're going to pay 80%, you're going to get stuck with a 20% bill. And for ease of math, your bill's $4,000. You're going to get the 50% discount, and you then owe $2,000. Your deductible's taken care of, right there. In the Montrose Regional Health Network. In the First Health Network, it's a $3,500 deductible. Your Montrose Regional Health carries over to your First Health Network. So if you're here and you've already met your $3,300 deductible, and then you go, I don't know, to your PCP, and they have to do some labs or something. Obviously the labs, most of them, Cedar Point will send you downstairs to our lab at the ACC, because Cedar Point is in the ACC. They'll send you downstairs to our lab. You're gonna get the discount on that, but for whatever reason, you've done something in your PCP's office, you've met $3,300 of your deductible here, you really only owe $200 more of your deductible to meet your First Health Network deductible. All right, any questions? I know, I told you guys, I am thoroughly going to confuse you. If you don't know the benefits in insurance world, it's my job to confuse you. All right, and the premiums on the bottom you can see are super low. We are able to do this for two reasons, because you have a super high deductible. Montrose Regional Health, we are self-insured here. So what that means is we are not only liable for the health insurance premiums, we're also liable for the claims. So if you're on this plan, obviously you're saving yourself money and you're saving the hospital money, because we're not going to pay anything until you've paid a $3,300 deductible. That's how we're able to keep our premiums lower than a lot of the corporate world premiums out there. My husband works for a big corporate company, and his premiums aren't nearly as fantastic as ours. And he doesn't get the MRH discount either. Sorry, but he's got a good job that he loves. But. Okay, any questions on this? Okay, all right, perfect. And you can see no copays because there's nothing covered, excuse me, on this plan until you meet your deductible. Now is where I'm going to start skipping around in your book. We are going to talk a little bit about prescription coverage. The prescription, all three plans sort of have some prescription coverage. Obviously, the high deductible health plan is not until you meet your deductible. I'm just going to briefly summarize the core plan prescription coverage. These are 30-day scripts right here. If you are on the core plan and you have a generic prescription, you will pay a $15 copay for a 30-day prescription. If you're on a single source brand drug, maybe they don't have a generic or you're allergic to the generic, your doctor will prescribe a brand name. And that is a $35 copay for a 30-day prescription. And then if you need a couple drugs mixed together to make one specific drug for you, that would be the multi-source brand drugs. You'll have a $45 copay for a 30-day prescription on the multi-source brand drugs. How many times did I say 30 days there? I said it a lot. The reason I say that and emphasize the 30-day, because if you're on a monthly maintenance drug, first of all, you're going to know you're on a monthly maintenance drug. You take it every day all year long. Have your provider write you a prescription for 90 days instead of 30 days. If you're on a 90-day monthly maintenance drug, the generic copay is $30 for a 90-day prescription. I just told you a second ago that the generic on the 30-day prescription is $15. So you're getting a month free, 30 days free if you are on a monthly maintenance drug and your provider writes you a 90-day script. I think the only reason they wouldn't do that is if you're just starting that prescription. They're going to want to see you after 30 days or something, and they're probably not going to write a 90, but after that, they generally will. And you do not have to order it through the mail. Ventegra is our new prescription management company, our PBM. Prescription benefits manager. They, any one of our pharmacies here will fill a 90-day script for you. If you prefer it to go through the mail, then you'll go through Costco. Ventegra deals directly with Costco, and they will do 90-day mail order prescriptions. Same price, same breakdown. So again, if you're on a 90-day prescription, if you're on a monthly maintenance drug, this is the way you want to go. Save money. I have 2 teenagers. I try to save money everywhere I can. All right, any questions on the prescriptions? Are you guys sure you're awake? Not one single question yet. Or am I doing that well of a job? Thank
Where do
you.
you usually get prescriptions?
I get them at City Market.
So that's where.
Yes, yes.
Where they
But
take our insurance.
they take our insurance, yes ma'am. All of our pharmacies here in town do. City Market, Safeway, Walmart, and the CVS in Target. Walgreens does too. Walgreens has the highest prices, by the way. In case you're, again, I have 2 teenagers. I have to shop. Walmart, I did learn a couple weeks ago. We just switched to Ventegra this year, January 1st of 2025. Walmart doesn't cover one of the, I want to say it's an anxiety medication. I am not clinical in any way, shape, or form. Ventegra doesn't cover it at Walmart. I could be wrong saying it's anxiety, but it is one of those drugs. Everything else is, you can pick it up. And it is the specific brand name. It wasn't that it was an antidepressant, if you will, or an anxiety. It was the specific brand name of that medication. So that's it. That's all I know of. It's super simple. If they don't cover it, maybe they'll give you a generic there or something. Or you can just say, I'm sorry, I have to go somewhere else. But all of our pharmacies here in town take Ventegra. All right. So get to the really cool stuff now, besides the medical insurance, because everybody needs that. The Section 125, also known as the Flexible Spending Account, the FSA, is it's a contribution you can make per pay period towards your FSA card. FSA is money you can put aside to use throughout the year for medical, dental, or vision expenses. The flexible spending account is a pre-tax contribution, yay, So it lowers your taxable income. Every time you hear lower taxable income, the IRS is involved because they want to know why they're not getting that income tax from you. Because the IRS is involved, you can only use those funds for medical, dental, or vision expenses. That said, if you Google FSA eligibility or HSA, which I'll talk about in a second, the list is endless. I'm not even kidding you. It is an endless list of things you can use your FSA account for. You can use it for over-the-counter cough and cold medicine, feminine hygiene products, ACE bandages, Band-Aids, sunscreen. That's my favorite, sunscreen. You can use your FSA for all of that stuff. You can use it for your copays, your deductibles, your dental visits, your vision. It truly is an endless list of things you can use it for. That said, if you use it at the grocery store, I highly recommend you do not ring it up with your groceries. Put that stuff aside, put your sunscreen and your Band-Aids and stuff aside, ring up your groceries, pay for that, and then have them ring that up separately and use your FSA card. Otherwise, it's likely to be denied, the transaction will be denied. And you have to submit the receipt for whatever you buy at the grocery store or prescription or whatever to EBMS, and you can do it all electronically. It's super easy. But you're going to upload all that to EBMS because, again, the IRS is involved. They have to make sure that you're not using it for a trip to Italy or Spain or something really cool like that. All right, so keep that in mind. Anytime you use your FSA card, save the receipt, and if it's at the doctor's office, make sure you get the super bill. They usually give you all that stuff when you check out. Now, if EBMS processes the claim, they're our third-party administrator. They process only our medical claims. They do the prescription too. I mean, the prescription goes through them and flows to the Integra, but the safest thing is just know if it's not a medical claim, you're going to have to submit the paperwork to EBMS. Dental Emeritus, they process our dental claims. They're separate from EBMS. So if you do anything that is not medical and you use your FSA card, be sure to save the paperwork because somewhere around 30 days, EBMS will ask you to upload it. If you don't upload it, they're going to stop your card. And speaking of the card, you can contribute annually $3,300 to an FSA. That's if you're single, if you're married, you and dependents, the whole family, whatever. $3,300 annually is all you can contribute to your FSA, which is a lot. And keep in mind that's pre-tax income or pre-tax contribution, so lowers your taxable income. When you sign up, you guys, by the way, all of you started today, right? I don't have any off cycles that started in January. Perfect. All of your benefits are effective March 1st. So when you sign up for your insurance, you have 30 days from today to enroll in your benefits, but your benefits will be effective March 1st. Keep that in mind. So today you're going to sign up, you're going to choose to contribute $1,000 annually to your FSA. Again, for ease of math, we take $20 a pay period for the next however many pay periods we have. 2 pay periods a year, we don't take any deductions except your 401k and your taxes. That would be the 3rd pay period in May and the 3rd pay period in November this year. Those are tax benefit-free paychecks. Every paycheck will take about $20, and again, don't take that as worth it. We're going to take $20 depending on what you contribute from your paycheck. It sits in an account. You've opted to contribute $1,000 annually. We take $20 a pay period. Let's say May 2nd or March 2nd. Something happens and you show up at the ER. And you know there's $300 copay just to walk into the ER. And maybe you know that it's something serious. The ER is going to have to do x-rays or something. Obviously it's serious if you're showing up at the ER. So you say, I'm going to go ahead and pay the $300 today, and then I'll get the discount off whatever else is owed. And the discount will come off the $300 too. You're still going to owe something. They will discount the $300 also, but you've already paid a portion of what you're going to owe after the discount. That debit card that you're going to receive in the mail comes in a plain white envelope. Don't throw that away if you're signing up for an FSA. It's front-loaded with whatever you chose to contribute for the year. Now this happened March 2nd. We haven't even taken your first contribution yet because your first paycheck in March is March 7th. Friday, March 7th will be your first paycheck in March. So I haven't even taken your first contribution yet, and you already have that debit card with $1,000 on it. You show up to the ER, they say you have a $300 copay. You just hand them the debit card and say, take it. Go ahead and charge that now. That is the bonus side of the FSA, is that you have that money up front to use, even though you haven't contributed to it. Now, if you leave here for any reason, which is not because you're not happy here, it's because you have to move back east or something and help take care of family, or maybe your spouse got the dream job of a lifetime and you're choosing to stay with your spouse and go back east, you have until the end of the month in which you're employed to use at least what you've contributed to the FSA. You can use the whole thing because it's all available to you day one, whatever day you get your FSA card. Depending on when you guys enroll, you may not have it March 1st, so don't panic. But you have until the end of the month in which you're employed to use at least what you've contributed. If you've used more than what you've contributed, I'm not going to come after you. We're not going to try and collect what you've used and hadn't contributed to. If you haven't used anything and you've contributed $1,000 already, and it's the end of the month in which you're employed, you lose it. Same thing at the end of the year. At the end of the year, $660 now. I don't think it's up there. It's on one of the pages in the book. $660 will roll over into 2026. Anything above that, if you haven't used it, you lose it. So be certain when you enroll in an FSA that you're going to use at least what you signed up for. Or don't leave more than $660 in there at the end of the year. And I think the book actually says $640 because the IRS hadn't given us the new numbers yet when we printed the books. So $660 will roll over into the next year. So keep that in mind. Unless you're not employed here anymore, then you lose it. Any questions on the FSA? And that was a lot, wasn't it? That was fun and confusing. All right, let's move on. By the way, you do not have to be on a medical plan and you can still enroll in the FSA as long as you're at least part-time or full-time employee. You don't have to be on one of our medical plans. That is not the case with the next one. You can use your FSA for your spouse and your dependents even if they're not on your medical plan. Again, you don't have to be on a plan anyhow. But you can use those funds that you contribute to an FSA for your spouse or your dependents' medical, dental, or vision expenses. Okay, let's talk about the HSA, which is different. It's the same but different. The HSA differs in that we do not administer this in any way, shape, or form other than we take your contribution from your paycheck and we directly deposit it into the bank of your choice. So you are going to have to be enrolled in a high deductible health plan to be eligible for an HSA. So you do have to be enrolled in a medical plan for this, and it has to be the high deductible. That's the only plan you can enroll in an HSA on. And it has to be a payroll contribution, so you can't just say, I'm just gonna throw some extra money in my HSA account. You cannot do that. Again, it is a pre-tax contribution, so the IRS gets involved. Also, you wouldn't want to take money out of some other bank account and put it in there because that money's already been taxed. Defeats the whole purpose. So pre-tax contribution, the IRS gets involved. You can only use it for medical, dental, or vision expenses. Again, an endless list of things you can use it for. Mobility scooter batteries. Who knew? Batteries for a mobility scooter. Covered. Your HSA will cover that. It's at the bank of your choice again. So if something happens and you move back east with your spouse, this is your bank account. Everything you contribute is yours. It goes with you. You never lose it. It's yours. Never ever lose it. At the end of the year, still yours. Doesn't matter. On the HSA, an employee only can contribute $4,300 annually to the HSA. The employee spouse or employee children, or the combination, a family, can contribute $8,550 annually to an HSA. Remember, when you're on a high deductible health plan, you have a $3,300 deductible. Nothing's covered on that plan until you meet your deductible. So that is why they allow us to do such higher contributions to an HSA. If you are age 55 or older, you can contribute an additional $1,000 annually to an HSA. Again, still pre-tax contributions, still medical, dental, or vision expenses. I have never, ever in my entire career, and I've been doing this for just shy of 30 years, have heard of the IRS auditing an HSA account. But they're the IRS, so they can do whatever they want. When you go to the store and you buy that sunscreen and that cough and cold medicine and so on and so forth, again, ring it up separately, take that receipt, stick it in a file folder in the back of a file cabinet, and forget about it for 7 years and then burn it. Because again, they can audit these accounts. So when you set your account up at the bank, if you are on a high deductible health plan and you want to enroll in an HSA, make sure the bank knows it's an HSA account. We have 3 or 4 banks here in town that do it. Wells Fargo does not. I know that. They have to know it's an HSA account. So if you're in Italy, because you're on vacation, and you catch a cold or something and you have to go buy some over-the-counter cough and cold medicine or whatever, be sure to save that receipt. Because that might say, oh my gosh, they were in Italy and they were using their HSA card. Let's audit that account. They probably won't, but if you're spending thousands of dollars out of the country on your HSA, they might. Once you are of legal retirement age, this is the bonus side of this pre-tax contribution to your HSA account. When you are of legal retirement age, which right now is age 64, everything you've contributed and saved up in there because you've been healthy, you haven't needed it for any medical, dental, or vision expenses, is yours to do with what you wish then. You are no longer subjected to the IRS guidelines of medical, dental, or vision. It is yours. Take that trip to Italy then. Nobody's going to audit you. If you are approaching Medicare, age 64, you cannot contribute to an HSA for 6 months prior to enrolling in Medicare. None of you in here look like you're even close to that, but I want you to know that 6 months prior to Medicare, you cannot contribute to an HSA. Again, IRS, because they want your income tax. That's the whole purpose. They just want our money. Okay, any questions about this? Here's another good side of this. If you enroll in a high deductible health plan, you saw your monthly premiums are super low, and you enroll in an HSA and you contribute at least $400 to your HSA, Montrose Regional Health will contribute $400. Unfortunately, you just missed the first $200. We do that the first pay period in January, but keep that in mind next year if you want to be on a high deductible health plan. They contribute the first $200 in January, and that's a little thank you for saving us money because you saved the hospital money being on this plan. We want to help you at least pay for your first office visit, because just for a consultation at a PCP is $200 just walking the door now. $200. So they're at least paying for one office visit. And then the second $200 they contribute to your account, the first pay period in July. You have to contribute at least $400 annually. And that's just a hey, thank you for that. You guys are listening. All right, if you have any questions, please don't hesitate to come and see me. When you enroll, you're going to enroll electronically. It should prompt you to print out an HSA direct deposit form. You're going to need to give me that so I know where to put your funds when I start taking them onto your paycheck. Okay. Sure, there's something else I want to say on it, but I can jump back. All right, so let's keep moving. I don't know what page it's on. This is where I stopped keeping track in my book. It is on page 7, it looks like. It starts on page 7. First Stop Health. I love First Stop Health. First Stop Health is 24/7 telehealth, telemedicine. So you have to be on one of our medical plans to be eligible for First Stop Health. But when you're on one of our medical plans, you're automatically enrolled in First Stop Health. You and any of your dependents that might be on our plan, or your spouse, if your spouse is eligible to be on our plan, are automatically enrolled in First Stop Health. So you wake up in the middle of the night and you have a pounding headache and you're sure it's, I don't know, maybe a sinus infection or something. It's kicking your backside and you're not gonna get up and go to the ER. Why? Because it's gonna cost you $300 just to walk in the door at the ER. You're not gonna wait until the next morning to go see somebody at urgent care because that's like $75 to walk into urgent care. You are gonna pick up your phone and you're gonna dial their toll-free number or hit the button on your phone because they have an awesome app. You will get a call back. They have an average response time of 10 minutes for a doctor to call you back. A real doctor. Not an MA or a PA, and I am not discounting those positions in any way, shape, or form, but an actual doctor will call you back and he or she can not only diagnose your symptoms, they can also write you a prescription. No narcotics, but they can write you a prescription. You will never, ever, ever receive a bill for this service. If you receive a bill, something went very wrong and you're gonna come and talk to me. This is 100% free to those on our medical plan because again, we're self-insured. So you're saving yourself money by not going to the ER. You're also saving the hospital money. So we are giving this to all of us on the medical plan. And I promise you this is a great benefit. I've used it more than once. I'm not ashamed to say, more than once. It's a great benefit. The only time you will pay anything for this plan is the next day when you go to the pharmacy to pick up your prescription, and then you're subject to whatever plan you're on. Again, you can only be on this plan. You're only eligible for the First Stop Health if you're on one of our medical plans. Same with your dependents. They have to be on their medical plan. Again, if you get a bill, talk to me because something went very, very wrong. The other side of this is virtual counseling. The telemedicine is 24/7. Virtual counseling is not. Virtual counseling is Monday through Friday, 8 a.m. to 8 p.m. our time zone. So you're not going to call somebody back east and maybe it's like 7:30, or let's try it again, back east is 2 hours ahead of us. 6:30 our time would be 8:30 their time. You know you get unlimited 1-hour sessions, but when it's 8:30 their time, they're going to be done at 9. That makes no sense, but just pretend it's 8. They use our time zone, so you don't have to worry about getting cut off 30 minutes into your counseling session, virtual counseling session. Monday through Friday, 8 a.m. to 8 p.m., our time zone, unlimited 1-hour sessions. Who doesn't need counseling from time to time? I mean, I need it. I have 2 teenagers, so. This has also been a huge success. It is 100% confidential. I don't know who uses it. I don't want to know who uses it. If you want to come talk to me, I am happy to talk to you. I am happy to help you get hooked up with this. But I don't know who uses it. They give me a bill, pay the bill, we're done. They don't give us any other information and we don't want it. We want you to know that you should not be ashamed, first of all, ever to use this benefit. But just in case you're afraid somebody is judging, this is 100% confidential, so don't not use it because of that. They cover things such as anxiety, depression, marital relationships, substance abuse, work-life stresses, and teenagers, and so much more. So much more. This is a great benefit. The whole package is a great benefit. The 24/7, talk to a doctor, or the virtual counseling. If you're doing virtual counseling and the counselor feels your situation may require a little more in person, they think you should see somebody in person, they will refer you to somebody locally, and then you're subject to whatever medical plan you're on for coverage at the local counselor. But this is 100% free all the time. We did not even roll this premium into our health insurance premiums, because if you're using this and not showing up at the ER or the urgent care or seeing a counselor in person, you're saving yourself money and the hospital. So They will never, ever bill us for this. All right, any questions on that? What's 2 times 2? All right. Dental insurance. We also offer a dental plan. This is a basic common dental plan. It's pretty standard across the board. It has an annual maximum benefit of $1,000 per person. There is an annual deductible per person of $100. The preventative care is covered at twice a year, covered at 100% twice a year. And when I say that, it's a little bit deceptive in that when you go to the dentist and you get your teeth cleaned and you get x-rays and all shiny and nice when you walk out, you pay nothing to nobody at the front desk. But that $200 cleaning and x-ray you just had came right off your $1,000 annual maximum. So keep that in mind. Later in the year, if you have something else done, you don't have the full $1,000 because you've gotten your teeth cleaned and it was covered at 100%. The basic services are covered at 80% after your deductible. The plan pays 80, you pay 20. The major services is 50%, and they have an orthodontia benefit here. It's a once-in-a-lifetime benefit. It's $1,000 for age 19 and under. A couple of you in here probably qualify for that. If you wanted braces or needed orthodontia service, $1,000 maximum lifetime benefit. Any questions on the dental? Emeritus, I asked you and then you immediately started talking. Any questions?
Like what dentist can you go to?
That's a good question. Emeritus is nationwide. Emeritus is the dental administrator here of this plan. They are nationwide. I think almost, and I do know there's probably a handful of our dentists here aren't in the Emeritus network. But you can go to any dentist you want. You're going to save more if you use an in-network provider, though, because you get better discounts. But they have a list. You're going to get on their website, emeritus.com, and you guys will get a card from EBMS, unless you only sign up for dental, then you won't. That gives you the Emeritus information. And make sure when you go to your dentist and you hand them your EBMS card, that they see the spot that's really tiny on the bottom that says for dental claims. All dental claims get submitted to Emeritus. 90% of the declinations I hear about are because your provider sent it to EBMS for processing, not Emeritus. And EBMS is going to deny it because they don't process our dental claims. So they'll deny it and you'll come to me sad and look it over and say, oh, your provider submitted it to EBMS, have them resubmit it to Emeritus. So keep that in mind, tell your provider, Emeritus only, don't submit it to EBMS. But you can use any dentist you want. Your dentist may not submit the claim for you, so you may have to pay your dentist and then submit for reimbursement to Emeritus. Good question. All right, vision benefits. This is also one of my top faves here, only because all 4 of us in my household wear glasses. This benefit excites me most because other vision plans I've been on, you can only get new frames covered every 24 to 36 months. This one, you get your exam every 12 months for a $10 copay, and basic lenses every 12 months for a $10 copay, and new frames every 12 months. I cannot go 2 weeks without my glasses while they're putting new lenses in my old frame. I can't even go an hour. So 2 weeks would be excruciating. You get new frames every 12 months on this plan, up to a $200 allowance. Now if your frames are more than $200, you just pay the difference. The plan covers up to $200, you pay the difference at a discounted rate. The same thing if you have, the basic lenses, if you have the UV protection put on, which most of the basic lenses now come with that automatically, but if you have the scratch coating or a transition lens or something fancy added to your basic lenses, that is not covered under the plan, although you get a discounted rate on it. You can also do contacts in lieu of glasses. Same thing, a $200 allowance annually for your contacts. The annual exam for the contacts, the copay is $60 not 10. That's the only difference there. You can see if you go out of network that they're only going to reimburse you $45, up to $45 for your exam, $30, $50, or $65 on your lenses, and up to $70 on your frames. So if you stick with an in-network provider, you get all the really great coverage. We use VSP as our network. So Principal Financial is our administrator, but they use the VSP network. VSP is nationwide. We have 3 VSP networks here in Montrose, 4 if you count the Walmart here, although I'm not sure how it works because when you pull up the network providers, they don't show up ours here in Montrose if you put our zip code in. But Walmart is part of the VSP network. So we have 3 here in Montrose. I think Delta has 1, but they're also here in Montrose. They go to both Montrose and Delta. Grand Junction probably 60, like so many in Grand Junction. 1 billion in Denver. So if you don't want to see one of our 3 providers here, you can go nationwide and see your provider. As long as they're in the VSP network, you get the best benefit here. They do have discounts available for LASIK surgery. It's not a benefit, it's a discount. But in your book there should be a phone number. It's a toll-free number you call for the LASIK surgery. These premiums are super amazing. These are monthly premiums. I told you I have 4 in my household that wear glasses. I pay approximately $300 annually for our premium, a little over $300 for our family premium. This pair of glasses alone was $1,200. I paid $180 out of pocket. That's it. And these aren't real diamonds. Like, that is how good this benefit is. And imagine I have 3 other people in my household. My husband's completely blind. His are way more expensive. He would really appreciate me telling you that. Anyhow, this is a fantastic benefit that the hospital offers us. So Mark will talk to you a little bit about this because he's our broker for this. This is an electronic enrollment still though. It'll be on your electronic enrollment stuff. So don't forget that. And there's nothing you have to turn in for this. You're going to do this electronically. All right, any questions so far? All right, let's move on to some other benefits that aren't medical, dental, or vision related. We have a retirement plan here at Montrose Regional Health. It is a great retirement plan because of the safe harbor side of it, which, I mean, any retirement plan is great if they offer one. The safe harbor here is amazing. We go through the standard. The standard is our administrator for our retirement plan. In 2025, if you are under age 50, you can contribute up to $23,500 annually, and you can contribute that either a traditional 401k or a pre-tax Roth 401k, whichever you choose. If you are 50 or older, you can contribute up to $31,000 annually to your 401k. And here's the best part. If you contribute up to 3%, the hospital matches your contribution at 100%. If you contribute 4% to your retirement, your future, the hospital will match at 3.5%. And if you contribute 5% to your retirement, the hospital matches you at 4%. That's the max match. You can contribute as much as you want over 5%. The hospital's max match is 4%. But 4% is 80% of the 5% contribution you make to get that. So you're getting 80% of your contribution absolutely free for showing up, doing what you love every day, and contributing to your future. That is what I love about this. In 2020, a lot of places stopped it because COVID put a lot of small businesses out of business and so on and so forth. We just improved ours. We did stop it for a few months in 2020, but in 2021 we improved it. Who knows what a vesting schedule is? We're usually in that room. This year they put us in this room, and that light in that room is, the board is on that side. That's why I'm blinded all the time on this one. A vesting schedule. Who knows what a vesting schedule is? All right. A vesting schedule is an awful, awful, awful thing. Most employers say you have to be here, and this only relates to the safe harbor side of the contributions, by the way. You are always 100% vested in what you contribute to your retirement. Most employers have this vesting schedule, and they say after 5 years, you will be 50% vested in what we have contributed to your future. After 7 years, 75%, and finally after 10 years, you're 100% vested in what the hospital or the company contributed on your behalf to your retirement. Here at Montrose Regional Health, we have no vesting schedule. Nothing. So when you have to move back east because your spouse has this amazing job, everything you have contributed to your 401k and all the safe harbor match is 100% yours to take with you if you want. Don't take it out, you'll get penalized, but you can roll it over into another account that qualifies for a retirement plan. 100% vested day one. So you contribute, the hospital matches every pay period. You do have to be here for 6 months, first of the following month, to be eligible to contribute to your 401k. So keep that in mind. For you guys, that's going to be like September 1st, you'll be eligible. No, yeah. March, April, May, June, July, August, September 1st, you guys will be eligible to start contributing. That's bad. I use my parents. It's so early. September 1st, you will be eligible to start contributing to your 401k. About a month before you're eligible to contribute, the Standard will send you a packet and they will tell you how to register yourself. It's all electronic. It will get you into their website, and the minute you put in your name and some personal information, it knows who you are. You guys will be in the Standard system after you receive your first paycheck here. So if you have a 401k somewhere else that you want to roll over, you can do that at least after your first pay period here. You can't contribute to it, but you can roll it over into the Standard if you wish. And if you choose to do that, you're going to come and see me and I'm going to help get you hooked up on that. All right, any questions about 401k? Yes?
What about para?
We do not have para here.
But
Oh.
can you roll it into it?
If your para lets you, yes. Any eligible 401k, IRA, Roth, you can roll into here, and it'll be put into the same bucket as it came from. Now, it won't be put into a para bucket, but para is a pre-tax contribution, so it'll go into a traditional 401k bucket, not a Roth. If you roll a Roth in, you're going to have to know how much. On the form, there's some questions. You say this much was Roth, so they know you've already been taxed on it, so you're not taxed later. They put it into the Roth bucket. Good question. All right. Let's keep going here then. Basic life insurance. As a part-time or full-time employee of Montrose Regional Health, Montrose Regional Health provides to us, at no cost to us, a basic life insurance policy. A minimum of $50,000, 1 times your annual salary. So if you make $40,000 annually, the hospital provides you with a $50,000 life insurance policy. If you make $100,000 annually, the hospital provides you with a $100,000 basic life insurance policy. They provide to our legal spouse a $10,000 life insurance policy, and to dependents, $5,000 life insurance policy. Covered dependents under 6 months of age is $200. Again, you have to be a part-time or a full-time employee to be eligible for this. And you can insure yourselves for additional voluntary life insurance. When you do that, when you enroll electronically, it's going to pull up your profile, so it's going to know your age and your gender and all the cool stuff because I already have you in the system. It's going to know who you are. You're going to log in under your username and password. If you want additional life insurance, there's a little drop down, and it's going to know that all your name tags are backwards. I can't even call on anybody because I can't see your names. They're going to know how old you are and what gender you are, and the rates that drop down are for you specific. It's going to tell you the increment you can insure yourself up to, a maximum of $500,000, and then in parentheses right next to it, it's going to give you your per pay period deduction for that amount. today, for the next 30 days, as new hires, you are eligible for $150,000 additional voluntary life insurance guarantee issue. That's a hard word to come up with all of a sudden. Guarantee issue, no underwriting. If you want to insure yourself for additional above 150, you're subject to underwriting. It will prompt you to print out the eligibility application, and then that'll prompt you to print out 2 forms. If it tells you that, please print them out, fill them out, and bring them to me. You have 30 days to enroll. Guarantee issue 150. If it prompts you for an application, you need to fill it out and get it to me within 30 days. If you bring it to me on day 31 after today, today's the 6th, so February has you have an additional 3 days into March, 6th, 7th, so you have till like March 9th. No, March 8th, 30 days, not 31. You have until March 8th to enroll in your benefits. That's also the day you have to turn any paperwork that it asks you to turn in to me. Allstate and New York Life, they are our administrators for our life insurance. They are the only 2 that we are not set up with electronic data, an EDI file. We can't automatically transmit that file to them. So I have to submit your paper applications for underwriting to them, even though it's guarantee issue up to $150,000. Allstate is guarantee issue, but you still have to do an application. It's guarantee issue today for 30 days. So please remember that you have 30 days if you're signing up for voluntary to turn in New York Life or Allstate applications to me. If you have questions about it, come see me. I also have applications. If you skip right through that section, I can get you one, so don't panic. The hospital also provides to us I keep saying employee, but we are caregivers. I need to change some of my slides a little bit here. Provides to us, the caregivers, a basic accidental death and dismemberment policy. Again, minimum $50,000, 1 times your annual salary. You can insure yourself for additional accidental death and dismemberment. You can insure your spouse for additional accidental death and dismemberment as well. You have to insure yourself for additional before you can insure your spouse for additional insurance. And if you do, your spouse has to sign a little piece of paper that says, I know my spouse is putting more insurance on me. I don't know why, but yeah, they have to know that you're insuring them. So not for the basic, but any additional voluntary. The basic accidental death and dismemberment that we have here is a double indemnity plan. So what that means is if you're in an accident and it's a bad accident and you pass away or you lose a limb, or you say pass away because losing a limb is not double indemnity. You pass away in the accident. Your beneficiary gets obviously the accidental death and dismemberment of however much you are insured for. They also get the life insurance side of it. So that's the double indemnity part. If you're in an accident and you die, they get both. Don't plan an accident, don't plan a death, but just know that it is a double indemnity. So same thing, if something happens to them and they're on your insurance, they're on your basic life, and you insured them for AD&D because we don't, that's voluntary, then it's also double indemnity. All right, Candidly, Student Loan Financial Wellness Program. I love this program too. We rolled this out in February of 2023. If you are, and you have to be, a full-time employee and have a federal student loan, then you are eligible to enroll in the financial wellness program that we offer here. You will get an email from Get Candidly in a couple weeks. And it's going to have a little blue link right in the center of it that says, hey, get started. Click that, go into their website, register yourself. It knows who you are. It's based off your work email address, which you guys will all get tomorrow when you go to your departments, or Monday. Some of you will be back in clinicals down here tomorrow. They'll give you your email, your username, and password, temporary password tomorrow. That's how you're going to log in. You will tell them who your loan servicing agent is and give them your loan number. They will verify it, and then they just bill us. We will pay for the first year towards your federal student loan $50 a month. For the second year, we pay $100 a month. And year 3 and beyond, we will pay $150 a month towards your federal student loan for a maximum of $10,800. I didn't make that number up. Again, IRS, they're really sticky. They tell us that's the maximum that we can contribute on your behalf or my behalf. I'm old, I don't have student loans anymore, but that's how much they will contribute, the hospital will contribute annually. Good Lord, over the lifetime of your student loan, $10,800. So if you have to be a full-time employee though, so keep that in mind. If you're full-time and have a federal student loan, get ready to have some of that paid off. All right, here's some of the voluntary insurance. I'm not going to talk about the cancer, the accident, or the short-term disability because Mark is going to cover those when he gets here. But I will talk to you a little bit about our Employee Assistance Program, our EAP. It was through Triad, and some of the brochures still say Triad. In fact, I think maybe what you have in your folders, the book definitely still says Triad. But it's all one, all in one, all one. Do you guys have the flyers in your packets? It'll be a separate piece of paper. Probably behind those for. Should be colorful, maybe. Maybe they're not in there anymore. Anyhow, it's no longer called the Triad, but I think part of it might still say the Triad somewhere in small letters. It is definitely in your benefits guidebook. Maybe on like page 13 or something like that. The Triad, anyhow, is a voluntary confidential assessment and short-term counseling by licensed counselors. It is deep in your books on page 19. Looks similar to this. Down at the bottom is a getting started. That's their website. The web address stayed the same, triad.com. The member portal, you'll get into the member portal, and our company name, our company code is on there, Montrose Hospital. That also stayed the same, even though it's all in one, all one. Short-term counseling by licensed counselors for all caregivers and your immediate family. Even if you don't actually, if you aren't actually employed by Montrose Regional Health, you are a surgeon who performs procedures here. You're still eligible for the Triad. You're an ER doc who is not on our payroll. They are eligible for the Triad, and so is their immediate family. You are eligible for up to 5 sessions per family incident. So, I told you I have 2 teenagers. They're great kids. They are. They're great kids. My son is 18. He is, he's not a planner. He's not a scheduler. He's a fly by the seat of my pants kind of guy, and he still gets his stuff done, which just throws me for a loop. He graduated last year in May. Went to the FFA State Convention the first week of June, was elected our FFA State Vice President this year. Super proud of him for that. Turned 18 a week after that, and then I had to move him out 2 weeks later. I had to move him to Denver because the state officers lived together. I was not prepared for that, by the way. I was prepared to send him to college in August, not leave me in June. Anyhow, he and I are opposites. Like, I am always on him. You need to fill out the scholarship. You need to do this. You need to get this done. And he managed to get it all done. He managed to get elected for a state office and did it all by the seat of his pants. He needs counseling because I'm always on him. Even now, he's like probably almost close to being in his town today. He's come home for a couple days, but he needs counseling because I am. Some might say helicopter mom. I don't know. I think I've gotten better over the years. My daughter, she is 16. She is a junior in high school. She is the exact opposite of him. She is just like me. She schedules everything. She plans everything. And if it is not planned and it is not scheduled, we don't lose it, but we're a little anxious about, things. And she is taking college courses right now. She wants to be a PA. So she's already in a CNA program as a junior in high school. And if she doesn't get an A, she's very, very, very hard on herself. I feel bad for her because she's going to learn soon that the real world is not like that. But she needs counseling because she needs to know that it's okay not to get A's all the time. Although admittedly, she's seen what her brother did and is trying to get a lot more scholarship money than he got. So she needs counseling. And then I'm trying to deal with both of them. And again, opposite ends of the spectrum. I need counseling. My husband, who tries to sort of just stay attached to us, like really has no say in anything because I'm a control freak. He needs counseling also. He's amazing, by the way, but he needs counseling too. So up to 5 sessions per family per incident. Those are 4 different incidences. They also offer financial counseling. They will not do your taxes for you, but they can refer you to somebody who can help you in your situation at a discounted rate. And then legal assistance. I love this one. They don't go to court with you either, but they can refer you to somebody who can help you in your situation at a discounted rate. They also have some legal forms and stuff online that you can click the button, download this NOLO software, which is great. I'll get to that in a second. But a will builder. Everybody needs a will. Everybody needs to know where they want their stuff to go when they're done, even if it's not worth anything. I went to a local attorney and they said, I will build you a will for $500. And I said, I don't have, $500 worth of stuff, like my house and my car. What more do I have, right? Which is obviously worth more than $500, but it's not worth $500 for a piece of paper to me. If you get on here, click it's not the same as it was when I did it, but you'll see it. It's legal advice. You can download the NOLO software. I didn't have to put my credit card in. I have never received an email, a text, or paper mail from NOLO software, whoever they are. Nothing. And within 15 minutes, I had a will built for free. The same thing I would have told that attorney for $500. I did it myself for free. So if you get on to Triad for no other reason, the will is the thing you should get on it for. And then I will stop talking about that. That is available to everybody here. All right, premium pay, the shift differential. If you work the night shift, which starts at 7 p.m. and ends at 7 a.m., you will be paid an additional $3 per hour for night shift, unless you're an RN, and then that's $4 an hour. If you are on call, which is pretty specific to clinical only, I'm admin, I'm not on call, but if I do, if somebody needs to get a hold of me on the weekend or something, it's remote call, and it's different than, the on-call pay is the same, it would be $3 an hour, but we're not on call. Remote call is different than the call back, but if you are on call, you're paid $3 per hour for every hour you're on call, unless you're actually in the hospital working. Then you're paid your base rate of pay, so it doesn't matter. $4 per hour if you're an RN, and then call back. If you are on call and you get called to come back into the hospital for any reason, unless you're IT, theirs is not the same at all. They are like me, remote. They can remote call back. If they have to come in, obviously it would be different, but IT can handle most everything over the phone and their computer at home. If you are called back to the hospital for any reason, you're going to come in, you're going to scan your badge and clock in, you're going to go deal with whatever it is you came back for. You have to prep somebody for surgery or whatever, depending on what department you're in. You're going to clock out when you're done, and you're going to transfer your time to call back. That tells your time card and payroll that you will get paid a minimum of 2 hours at time and a half, even if you were only here for 15 minutes. 2 hours at time and a half. So don't forget to transfer your time, and I will show you that hopefully soon, how to do that on your time cards. And then the weekend differential, if you work the weekend, which starts Friday at 7 p.m. and ends Monday morning at 7 a.m., you're paid a weekend shift differential of 10% of your base rate of pay. And then the holiday differential, if you are scheduled to work on a holiday, and you have to be scheduled or you have to be called in on the holiday, you are paid at time and a half for New Year's Day, Memorial Day, 4th of July, Labor Day, Thanksgiving Day, and Christmas Day. Those are the holidays that the hospital recognizes and will pay time and a half for. If you are admin and you're scheduled to work and Christmas Day is on a Wednesday, I'm not paid. If I show up after gifts are open and dinner's done because my kids don't want to hang out with me anymore or whatever, I do it for convenience. I'm paid my base rate of pay. I'm not paid the time and a half. If you're scheduled, you're paid time and a half. Any questions on that? Also, if you want to be paid for a holiday and it's on a Wednesday and your department is closed, you have to use PTO. But our PTO is at such an accrual that it covers all that cool stuff, which I think is next. Ta-da! Okay, you guys started accruing this morning at 8 o'clock when I clocked you in, or when you clock in your department. I haven't clocked anybody in yet, but eventually it'll happen. You guys started accruing PTO this morning when you clocked in. Your first year, you can accrue 5.23 hours per 80-hour pay period. I say that because the majority of clinical, the majority meaning those that work here in the hospital, because our outlying clinics are all, most of them are Monday through Friday. I'll say 8 to 5. Clinical generally works a 72-hour pay period. They are scheduled 3 12-hour shifts generally. So you're working 72 hours, not 80. It is not less than the 80 by any stretch, because a 12-hour shift is a long shift. You will accrue 90% of the 5.23 hours because you work 90% of the 80. Now, if you work up to 80 hours, assuming none of it is overtime, callback, or on call, you will accrue the full 5.23 per pay period for year 1. Year 2 through 5 is 6.47 hours per 80-hour pay period. 6 through 9 is 8 hours per 80-hour pay period, and 10 and beyond is 9.85 hours per 80-hour pay period. The maximum you can have in your bank at any given time is 240 hours. First of all, if you have 240 hours in your bank, you need a vacation. You have not taken a day off, clearly. You need a vacation, but that's the maximum you can have. It happens. I mean, especially if you are working 3 12s consecutively, you have 4 days off consecutively. How much PTO do you really need to use? So it can happen. You will have the option to cash out your PTO. You can cash out a maximum of 80 hours per year, once a year. You have to elect by December 31st of this year what you want me to cash out November of next year. I know that's tough, but that's the IRS for you. If we don't do it that way, if we just let you willy-nilly cash it out when you need it or want it, they're going to start taxing our accruals as we accrue them, and that's a nightmare for you and for me and for the gal who cuts our payroll checks. So we said no, we'll do it once a year. Obviously, if you have an emergent situation, if your electricity is going to be shut off, or your mortgage, or there's a bad accident or fire or something, you can request to cash it out, and just fill out a form and give it to me, and we'll review it and let you cash it out if you have it available. You can also donate your PTO to the Friends and Family Club. The Friends and Family Club is a pool of donations, either monetarily or PTO, that we caregivers have donated that will help caregivers out in emergent situations if they don't have enough PTO or EIBs, like you just started today. Maybe next week you're out for 3 weeks because you broke a leg or something. We want you to stay engaged and to heal, especially if you're clinical. We don't want you coming back with a broken leg and prolonging your injury or making it worse. We want you home to heal, so you can apply, you can request assistance. Also a form you're going to fill out and turn in to me. And the Friends and Family Club, depending on their the financial pool that they've got, can grant you some PTO to use while you're out healing, not to be repaid. All right, extended illness bank. I know I have to start rushing. The EIB Extended Illness Bank is a bank of hours that you will start accruing also this morning. Does not accrue as fast as PTO, but you can accrue 2.2 hours per 80-hour pay period that will go into this other accrual bank, the EIB. You can use EIB. The maximum hours you can bank in EIB is 480, which if you're a full-time 80-hour per pay period caregiver, that covers 12 weeks of pay for an extended illness. So your first 48 hours of missed shifts, not necessarily 48 hours like yesterday and today, 48 hours of missed shifts, you will have to use PTO or take unpaid. But after that, you can start using the accruals you have built up in your EIB account. So when you're out for 3 weeks recovering from that broken leg, you can still collect a paycheck and pay your mortgage or car payment or whatever. That's what the EIB bank account or accrual bank is. It's for your very own personal illness or injury, though. It's not for a spouse or a dependent. We have caregivers that use it for maternity leave, for procedures they have to have, stuff like that. Broken legs, whatever, broken arm. Maybe you have pneumonia and you're out for a couple of weeks. Your first 48 hours obviously will be PTO or unpaid, and then you can use your EIB. That also falls in line, the 480, with the FMLA, and I'll hit that in a second. Just barely hit it. All right, any questions on those two? I'm going to swim through this one really fast. The PRNs get paid sick leave. They do not accrue EIB or PTO, but they will accrue paid sick leave. 1 hour for every 30 hours worked. The maximum they can use annually is 48 hours, and they can take that in 15-minute increments as necessary. And that's it for paid sick, since none of you are PRNs in here. All of us in here, our PTO will be used for any reason around if we want. If we choose to use it instead of taking it unpaid. All right, leaves of absences. These are the common leaves of absences that every employer nationwide has to abide by, most of them. Personal leave, general medical, military, educational, bereavement, and FMLA leaves of absences. Not one person in this room will qualify for or be eligible for FMLA until you've been here for 1 year and worked 1,250 hours. And then you will be eligible for FMLA. The other side of that is that the state of Colorado has the Colorado Family /PFML leave that you'll be eligible for here after 180 days, 190 or 90 days. It doesn't take long to become eligible for that. So if you have a procedure coming up, you're going to come to me. I'm not going to hit those hard. FMLA is a job protected leave. The Colorado Family PFML is a job protected, potentially paid leave. So for whatever reason, if you have to be out, whether it's care for a spouse, a dependent, or yourself, you're going to come and see me. I will talk you through and show you how to deal with all of that. That's all I'm going to say on that. Otherwise, we can get into weeds that nobody wants to deal with right now. All right. All of our policies and procedures are on the internet, which I will also show you in a second. I highly recommend, when you have free time between patients or tasks, if you're admin, whatever, to log on there and review some of our policies. The leave of absence policy is probably the most important one to know about right now. Caregivers can be granted anywhere from 20 to 40 hours paid bereavement leave, depending on, obviously, your employment status, full-time or part-time, and the relationship to the deceased. PRNs are not eligible for bereavement leave. And then jury duty. If you're called to be on a jury, please do your civic duty. We want you to do your civic duty. We will pay you your base rate of pay for up to 8 hours a day to sit on that jury. All we ask in return is that very small stipend that you get from the courts, and I promise you, it is a very small stipend compared to your base rate of pay for 8 hours. Turn that over to the hospital in exchange for your base rate of pay. That's all I have on that. Any questions about that? And you'll want to bring us a little note that says, I have jury duty. Any questions? No? All right. Make sure you're awake. I'm going to keep asking that. The next person is, Mark. He's not going to ask you that. But Bill comes in after Mark. He's our HR director. He's fast and fun. I mean, I love working with him. His office is right next to mine. Okay, the cafeteria discount. You are eligible. It says 20 still. Good Lord. 25% discount. We increased the discount because prices kept going up. So we got to increase our discount. You are eligible for a 25% discount upstairs at the lobby grill. You must have your badge. They are not going to give you a discount if you come in without your badge and purchase something up there. You must have your badge. You will get 25% off your purchase. You can also charge your meal or purchase to your paycheck with your badge. And you guys will get your badges by the end of today. So when you leave today, you're going to scan them and clock out. But you just scan it when you're up in the lobby grill, and it'll come right out of your paycheck. You will never even notice it. The food is great, by the way. I love the food here. You guys will get a small sampling today at lunch. And when you guys fill out your time cards, by the way, do not include your lunch. You are straight today from 8 till whenever you're done here, or if you go to your department after this, whenever you get to leave. Do not put a lunch hour in there. We keep you here for lunch. We provide lunch. You are not to take that time off your time card. All right, check the meal service policy if you have any questions on that. It's pretty straightforward though. And then direct deposit. I apologize. So far I only have 2 of you set up in here, but I will have the rest of you in the system by the end of the day. So I know that 2 of you have direct deposit set up already. If for some reason you don't have direct deposit set up, or you have to change your bank for any reason, obviously you're gonna let me know, because everything goes through me before it goes anywhere. I sound nosy there too, don't I? All right. Well, yeah, I'm gonna know about it because it goes through me, but you will have a paper check cut on Payday Fridays. So tomorrow is payday for us. You guys will get your first paycheck on February 21st, Friday the 21st. If you have direct deposit, you should not have to worry about it not being pre-noted by then. But if for some reason it's not pre-noted, I will reach out to you anyhow and let you know that something happened. Give me a copy. That's why we request copies of your bank account and routing number. Some people don't always give it to us. And yeah, if we have to mail your paper check, we do not guarantee that it's in your mailbox Friday when the rest of us get paid. We don't even stop payment on it for 10 business days. So please, if you have to change your account for any reason, just say, hey, hold my check. And you can come pick it up in my office on Payday Fridays. Let's not risk the USPS. That's all I'm gonna say about that. Every other Friday when I wake up, it's in my bank. And the Employee Club. The Employee Club is a fundraising savings system to help meet emergent needs for caregivers. So if you are a member of the Employee Club, you will contribute a minimum of $3 a month. We deduct that out of the first pay period of every month, first paycheck of every month, and that's it. A minimum of $3 a month. You have to be a member and contribute for 3 months before you can request assistance. But let's say you wake up in the morning and your heat is out and you cannot afford a service call, let alone purchase a new furnace. You can request assistance from the Employee Club. That is considered an emergent situation. You'll go on the internet and click the Employee Club, and it'll have a form that you'll fill out electronically, and they can approve up to $750 not repayable. You don't have to repay it. You're a member, other people are members. That is we caregivers helping ourselves out sometimes and helping other caregivers out. That is all that is. It is a great program. In the position I'm in, I have seen this used a lot, and it has really helped a lot of our caregivers, more than we think it would. So, there's that. And that's it. That's all I have for you guys there. I'm gonna shut this presentation off now. We are going to switch gears to how to set up your benefits. Do you guys have any question on the benefits though first before I move over to the other side? Should I do trivia now? I'm just kidding. I'm just kidding. We're gonna shut this down. And when you log on to any web browser here in the hospital, this is what it's going to come to. This is our intranet page. I am going to highly recommend you only use Chrome, especially when you're using Kronos. Edge seems to glitch a lot more with Kronos than Chrome does. I'm not going to say Chrome never glitches with it, but Edge seems to glitch a lot more. So log into the the Chrome web browser, and then you're going to see this. This is where you're going to go to get your time card, Kronos Timekeeping, and I'll show you that in a second. Here under the HR tab is where the policies and procedures are. That is also where you will find, stay there, the employee club. You'll click on that, and then you'll have a donation form or a request for assistance form over there. The policies and procedures, which are really endless, and some important forms, you'll also find those on there. It says eStub, that's no longer a thing, you can disregard that. But we are going to go into our timekeeper first here. Kronos Timekeeping, and when you log in, which you guys will get tomorrow, oh, it's still me, look at that. Nobody else uses this in here, I guess. It will take you right to your Timekeeper homepage. And this is what your Timekeeper homepage will look like. Something like this. You will not have this many widgets on it when you first open it. The widget I need you to be concerned about right away though is My Benefits. This widget. This is the only way you're going to get to your benefits. The only way. So keep that in mind. You will scroll to the bottom of this page if that widget's not set up, and I don't think we've got it set up yet to auto-populate. So you'll scroll to the bottom of the page, hit that little edit pencil there, and the instructions you have are pretty spot on. You'll find the widget over here to the right that says My Benefits. You'll click in the widget and hit apply, and it will automatically populate on your homepage. Once you're in there, once you have this cool widget set up, you will click the blue link that says My Benefits Plan Source, and it takes you right into your benefits center that is built specifically for you. Nobody else. Yours is going to say Get Started. A blue link right here is going to say Get Started. You're going to click that. You're going to review your profile. It'll show you your profile first. You cannot make any changes to your profile in Plan Source. You're going to have to reach out to me. I'll make the changes on my side for you, and then they'll eventually migrate over. But you're going to review your profile, make sure your name, address, phone number, birthday, all that is correct. And then at the bottom, it'll say, next, review your family. And remember, even if you're going to decline all of our benefits, you don't want our medical, dental, vision, whatever, you are still going to enter your spouse and your dependents, because that's a trick question. They get the basic life insurance, and you want them to have the basic life insurance. So you have to put them in the system. You'll need their name, hopefully you know that anyhow, their birthday, and their social security number. So be sure to enter your family in there. And then at the bottom of your family page, it'll say, let's review your benefits or something, and that's when it'll take you to your benefits page. Yours is obviously going to look different because yours will have all these white boxes will be blue. You cannot check out until every blue box is white. As you go through, it'll start with the tobacco survey. Please answer it honestly. We do have a $50 per person per pay period tobacco surcharge. It's really for you and your spouse. So please answer that honestly. If you are a tobacco or nicotine user and you are getting a surcharge, if you, and in our book it talks about some cessation programs, if you enroll in a cessation program and complete the program, just bring me your completion certificate. I will remove the surcharge for you. So you will no longer be charged that. And then it'll go into your medical insurance. When you open your medical insurance, when you click the blue button, it will give you all three options that you are eligible for based on your status. It'll either be core full-time, basic full-time, or high deductible health plan full-time, and then there will also be a decline button. You will choose whichever plan you want, and you'll know because you have it all there in front of you. When you open that plan up, it's going to show your whole family because you put your family in there. So above the actual plan up here will be you, spouse, and dependents, or however you entered them into the system. If you want them on your plan, any of the plans from here on out, from the rest of the way down, make sure there's a check mark in the box next to their name. If you don't want them on your plan, no check mark. We charge according to what you enter. So keep that in mind. If you don't want them, do not put a check mark in the box. You'll do the medical, dental, vision, and then it'll say, once you've checked the boxes and chosen your plan, it'll say update cart. You're gonna know everything you sign up for, you're gonna know what I'm gonna pull out of your pay period, or your paycheck per pay period, because it adds it up here in the top for you. Actually, I think when you're actually doing it the first time, it adds it up in the bottom, but it might do both. You're gonna know what's being deducted from every single paycheck as you go along. You're going to do those. You'll do the medical FSA. That's the flexible spending account. Remember, you don't have to be enrolled in any of the plans to do the FSA. If you enroll in the high deductible plan, if that's the benefit, the medical plan you choose, the FSA will not populate. The HSA will populate, and that's where you'll choose your contribution. It'll tell you to print out a direct deposit form. We also have the dependent care FSA. If you have a dependent that is generally age 13 or under that goes to an after-school program or daycare or preschool or private school, you can enroll in a dependent care program. $2,500 annually as an individual, $5,000 married, but you can only contribute $2,500. So you can enroll in that. That's also a pre-tax contribution. That doesn't work exactly like the FSA does, though. You actually have to have the dependent care sign a form, a claim form that says they billed you for this rate, this is what you owe, and then you can get the money out of it. And then it goes into your basic life insurance. Remember, that's the life insurance that we provide to you, your spouse, and your benefit, or your dependents. After that is the voluntary. That's where you'll see the drop down. For the voluntary life insurance, it has a drop down, and you can choose your increment that you want to insure yourself up to. And next to it in parentheses will be your per pay period deduction. Same with your spouse. You have to put supplemental insurance on yourself before you can do it on your spouse. And then what Mark's going to discuss, the Allstate benefits. This is a survey, and then you can enroll in any of these. These will prompt you to fill out an application. Mark will have an application in the folder he gives you, so you don't necessarily have to print them out. He will have them available to you. But the Allstate and the New York Life, you have 30 days from today to turn the paper application into me if you choose those. Once you're done with that, at the bottom it'll say review and check out, or beneficiaries. I don't remember which one's first, but you'll click that blue link. And remember, all these have to be white before you can check out. Click that, enter your beneficiary, check out, you're done. Unless you owe me paperwork, you're done. Benefits are done, it's that easy. PRNs don't even touch this, though we don't have any PRNs in here. Any questions on that? Please, please, please come and see me, call me, email. If you have any questions, I will help you through that. And then the last thing I want to hit really quick, because Mark is already here, is back to your time card. When you guys are responsible for your time cards every pay period. The pay period ends on Saturday, so our pay period ended last Saturday. On your last shift, if your last shift for the pay period is Thursday, before you leave Thursday, make sure you approve your time card. Make sure you look at your time card and approve it. Even though the payroll doesn't end, the pay period doesn't end until Saturday, your last shift is Thursday go in and approve it. You are accountable for your time card. So you're gonna log into your Kronos Timekeeper again, and you can see, you can do lots of cool stuff here. You can add any of these widgets. You saw all the widgets. You can add one down below over there is one that says My Pay. You can get to your pay stubs there. You can view your year-end tax forms there. The update direct deposit it is not true. Don't do it. It just takes you to a screen that you just sit and go, what am I supposed to do? It's not letting me do anything. But the rest of the stuff works there. You're gonna go into your own time card. It's gonna look just like this. It has the whole pay period here. It starts on a Sunday, ends on a Saturday, so you're gonna know when the pay period ends. You're gonna know when you have to approve that time card. The callback is the one I really want to hit for you guys because that's when you clock in and you're coming into work for 15 minutes. You're gonna hit the transfer button next to the hours you worked. You're gonna clock in, you're gonna clock out, you're gonna hit that transfer. You can do this on the time clock too. This is much easier though. You will search or you can use the drop down. Let's try it. You have to build your drop down. No? Okay, well, clearly then you're just gonna search and this will pull down. You're gonna add a work rule when you're doing callback. You're gonna add a work rule and it gives you all these cool work rules here. You are gonna click callback or callback surge. If you work in the surgery department, you're gonna use callback surge. Or if you're IT, you'll use callback remote. That will prompt it to pay you a minimum of 2 hours at time and a half. So don't forget that. And again, approve your time card at the end of every pay period. Just click the approval button over here once you like it. If you don't like it, fix it. Make sure you've clocked in and out every day. Make sure your lunch punches are in and out. Not today. No lunch punches for you today. And then approve it. All right, I know that was really fast. There is some Duo instructions there if you want to hook your time card up to your mobile phone. There's Duo instructions. And there's also some tips about time cards in there as well. So, any questions? Nothing still? All right, well, let me introduce you to Mark. He is our the agent I was telling you about earlier. He is our independent broker for the voluntary supplemental insurance through Allstate, and he does the VSP. Again, no app for the VSP, that's electronic. I have it right there. And I'm gonna hang out in the back, in case you guys, wanna, I don't know, chat for a few minutes after he's done.
Okay, thanks, Brenda. Again, I'm Mark Neal, and I've been working with the hospital, well, I guess a little over 20 years now. And my section deals with supplemental and voluntary benefits. I work with a lot of carriers. In this case, it's Allstate, so I pass those packets out. A couple of quick points before we get into it. I'm not going to take too long. I know Brenda's talked a little bit about the vision plan. Anyway, the hospital is simply sponsoring the programs from Allstate. There's 3 products we're going to look at: accident, cancer, and disability. In other words, they've allowed me to come in and talk to you about them. But you, the employee, if you do enroll specifically in the accident or cancer plan, you are the owner. And what that means is if you ever leave employment, for whatever reason, you can continue to directly same rates, same benefits. Certainly, I would assist you in that transition. The disability, unfortunately, is a function of working here at the hospital, so it's not portable. Benefits are paid directly to you. They pay in addition to anything else that you have, whether it's through the group health plan that Brenda talked about. You may have your own individual policy, or you may be covered through a spouse. Those plans are going to pay what they're going to pay, and then Allstate's going to pay what they need to pay. That money comes directly to you. You can do what you want with it. If you don't have any questions during the little talk here, my card is in there. Feel free to call or email me later with questions. I know you're inundated with a lot of material, so I'm just gonna highlight some points. Anyway, we'll start, if you open the packet up, we'll start on the right-hand side. You see those brochures listed. The first one by far is the most popular, the accident plan. Specifically in Colorado, I'm assuming that's because of the mountains and all the things that we can do in the mountains. But if you open that up, you'll see the little grid there, and you'll see that there are 2 plan options available to you. You can cover children or spouses if that applies to you. What you're looking at are per occurrence benefits. It is off the job to keep the rates down because you are covered under workers' comp on the job. Anyway, these are per occurrence benefits, so if you happen to be accident prone, more power to you. Starting with accidental death and dismemberment, moving on down, X-ray, emergency room services on the other side, you'll see some of those other benefits listed. Towards the bottom, under physical therapy, there's an area called transportation and lodging. You may choose to go to Denver or Salt Lake, and you can and get reimbursed for mileage. On the bottom, outpatient physician's benefit, a really attractive benefit. You can see the reimbursements there, depending on the plan. If you're on the employee-only plan, you can get 2 per year. If you're on the family plan, you could get 4 per year. The only stipulation on the family plan is you can't get more than 2 on any one specific individual in your unit, but you can get a total of 4. And what this deals with, years ago when it was set up, it dealt with going to a doctor, outpatient in his office for a well or a sick visit. But actually, Allstate has expanded their definition of provider to include not only a physician, but a dentist for any reason, cavity cleaning, root canal, you name it. Vision provider for your frames, lenses, and exams. And believe it or not, even a chiropractor for something as simple as an adjustment. So it makes the benefit quite a bit more attractive because you've got 4 providers to choose from throughout the year to get those reimbursements. If you look on the right, you see that the premiums show monthly. You can divide that by 2 and that'll tell you your per pay period. So let's just say I'm an employee only and I'm interested in plan 2, the better plan. My premium outlay would be $1,561 a month, or about $180 a year. But keep in mind you have the potential to recoup $200 from that outpatient physician's benefit. So it's a real attractive way to recoup your money, at the same time have a full-blown accident plan if something serious were to happen. Questions? I know I'm going through it pretty quick. Okay. Next one is a cancer plan, and if you'll open that up, you'll see the grid there with the 3 plan options available to you. Premiums are out there to the right, again, they're shown monthly. Other plans that are out there are critical illness plans, which cover cancer. Those are good plans. They're good for what they are, but they're a little different. Basically, under those plans, you would elect a benefit, say like $10,000, and then if you came down with cancer, you would receive that benefit. But once you've received your $10,000, you've actually exhausted the policy, and you can't claim anymore on it. Well, Allstate's designed this to where you receive annual benefits. And they did so because, unfortunately, the one word that comes up with cancer is linger. And if it does go from whether it's 1 year or 10 years, if you're under treatment, you'll get benefits for each year that you're under treatment. So again, 3 plan options available, starting with hospital confinement, moving on down radiation chemo. Again, you see that section in the middle where health insurance normally doesn't cover, and that's transportation and lodging. You may choose to go to MD Anderson in Houston or the Mayo Clinic up in Minnesota, and you can do that and get reimbursed. On the bottom, a couple of additional benefits. Cancer initial diagnosis, where you receive a little bit of a lump sum benefit the first time you're diagnosed with cancer. Cancer screening, each covered person can get a $50 reimbursement once a year for things like mammogram, prostate, pap smear, some type of blood diagnostic test for cancer. Again, it pays in addition to whatever your health insurance pays. Questions on that? The last brochure is an opportunity to protect your income in the event that you went out from an accident or an illness. And if you did, Allstate's going to cover 60% of your income. If you see those 2 grids there, you'll see the first one is a benefit period of 12 months or 1 year after a 14-day waiting period. The other one is a 2-year or 24-month benefit period after a 30-day waiting period. You can see the age brackets on top. On the left-hand side is the monthly benefit. If you'll just take your salary, divide by 12, and whatever that number is, take 60% of it. And that will equate to the benefit on the left-hand side. So let's just say I'm an employee and my 60%, and I'm looking at the first plan, the 12-month, and my 60% is $2,000. And even though I'm a lot older, we'll look in the first column and it says $41.17 a month, or a little over $20 a pay. So I look at that and say, I really think I should do something. I like to ski, I like to do all those things in the mountains, but God, right now with all my other benefit costs, I'm just not sure I'm ready to spring for that. Well, there isn't another carrier that does offer disability coverage that will allow you to do this, and that is that if you enroll, you have to get your 60% benefit or you can't enroll. Allstate will allow you to buy up to the 60% benefit. So in that case, if I wasn't ready to pay the $41.17 for $2,000, I can cut it in half and still cover $1,000, but I'll cut my cost down to a little over $20 a month or $10 a pay. So it's just a very nice flexible feature that other companies don't allow you to do. Keep in mind, as a new hire, the disability coverage is offered to you on a guarantee issue basis. If you want it, it's yours, no health questions asked. If you don't want it or you don't want any other coverages, that's fine. We encourage you just to hold on to your packet because we'll be using them again probably in late October for open enrollment in November. So you're welcome to do that. But if you do enroll later, because you've turned it down now, if you do enroll later or you don't buy your full 60% and then you want to buy up to the 60% later, you can do that, but you're subject to health questions at that time. But right now it is guarantee issue. And then the last thing we like to mention again is guarantee issue. Again means if you want it, you got it. But once you're on the plan, you're subject to what we call standard pre-existing condition limitations. And that just simply means in the year prior to your effective date, basically if you've seen a doctor for something, it's going to be pre-existing. You may have had knee surgery, back surgery, you may be on medicine for a heart issue or whatever. Any pre-existing is going to have a 12-month wait. You have to be on the plan 12 months, and then after that, if that pre-existing does cause a disability, you have coverage for it. Just not if it pops up in the first year, and that's a standard exclusion. Behind that is the paper enrollment. This is not an all or nothing. Maybe the accident plan's of interest to you, maybe one of the other ones. You can just complete that and turn that into Brenda sometime, like she said, in the next few weeks. On the left-hand side, if you do enroll, there's a little flyer called My Benefits. It's just a little informational piece / instructional piece on how you can get online at allstateatwork.com to get yourself access to your policy and policy information. You don't have to do it. You can call my office if you need an address change or if you let Brenda know the name change or what have you. But this does give you access to it. If you remember the outpatient physician benefit on the accident plan and the cancer screening, they're very simple. If you do want reimbursements to come back to you direct deposit, then you do have to get on the My Benefits site and register. But if you don't mind a check coming to you in the mail, you don't have to register. Okay. Anyway, it's just an informational piece as well. Claims, pretty simple. Those two features that I talked about right now, the cancer screening and the outpatient physician's benefit, one-page claim form. What we do normally is email it to you when we know you have a claim. You can send it in directly to Allstate. You can give it to Brenda. You can email it to me. I'll send it up. Those usually take 48 to 72 hours to turn around. But if it's a lengthier claim, a bad cancer, bad accident, what have you, it's probably, I think it's about an eight-page claim form. We'll still email it to you. But for those lengthy claims, I prefer you turn them into Brenda where I can send them in for sure. Because that way I can track it for you. Because those lengthy claims can take 4 to 6 weeks to process depending on additional information they may need from a doctor or a police report or something like that. So keep that in mind. Questions? Okay. Behind the My Benefits is a little flyer that we came up, another program from Allstate that we offered about 3, maybe 4 years ago, involving identity theft protection. Allstate has teamed up with a company called InfoArmor. If you look on the back of page 1, there's some bullet points, and I've highlighted probably the most important one. But I think a lot of us know if it hadn't happened to us, somebody that's either gotten a debit card hacked or some kind of account compromised, well, you've got 24/7 protection with Allstate. If you think something's happened, you can pick up the 800 number, to InfoArmor, and they'll run with it. They monitor all your bank accounts, credit accounts, and like I said, with these bullet points, I've highlighted probably one of the more important ones, and that is hackers are working their way into larger accounts now, like HSAs and 401ks. But under this plan, you have $1 million identity theft protection, which either reimburses you for lost expense, stolen monies, or expenses dealing with it, like with an attorney or something. Again, it is 24/7. The enrollment form is attached to that as well. It is portable if you do leave. You can, just like the cancer and the accident plan. Premium is very inexpensive. Employee only $9.95 a month, and family $17.95. And by family, I mean household. So if you have parents living with you, you can include them. And actually, if you have parents that are 65 or over, not even living with you or not even dependent on you financially, you can still include them under your household. So it's a nice feature as well. Questions on that? The last thing I'll talk about before I'm done is shifting gears a little bit, is a voluntary vision plan through Principal Financial. And they utilize the VSP network. There's 3 pages there that are stapled together. On the back is the list of the 3 providers that are in the area. VSP is nationwide though, obviously way too many to print, hundreds and hundreds. So if you're traveling somewhere, you can either call them on the 800 number or get on VSP.com. Once you contact them, let them know where you're at, by city or zip code, and they'll tell you the providers in the area. You obviously want to try to stay in network to limit your cost, but you can go out of network and get reimbursed. I know, again, Brenda's talked a little bit about it, but again, on page 1, you can see you can go in for an exam once a year. Very generous. Most employer plans are at least every 2 years and sometimes 3. And if you do, you'll pay a $10 copay. The last time I had went for an exam, I didn't have vision coverage, and my exam was close to $140. So that gives you an idea of what the discount is. In addition, you can go once a year for your frames and lenses. Now, there is a $200 allowance. So what that means is, regardless of how much the glasses cost, the first $200, your copay goes towards that. I think most of you know, whether you wear glasses or not, how expensive they can be, $300, $400, $500 a pair. So that copay will go towards the $200. Anything over, you can take advantage of other discounts through the plans, and work with the provider directly on that as well. Contacts in lieu of glasses, up to a $60 copay. On the back, you're going to see the premiums listed monthly. Right above that is a little chart that tells you how much you'll get reimbursed if you go out of network. You're not going to get 100% because it's out of network, but for example, you can get up to $45 to get reimbursed for an exam if you go out of network, and that's not bad considering it's out of network. Second page is some additional information on discounts like laser vision, retinal screening, that type of thing, so you might just take a look at that. It also includes a hearing aid benefit. Hearing aids now can run anywhere from $2,000, $3,000, $4,000 a pair. Under the plan, you probably get about a 35 to 40% discount with that, so it's a nice feature. One other thing I want to back up a second, I did want to mention on the identity theft. I'm actually enrolled in it. I think I enrolled in it about a year ago. And I will say it was kind of neat because I get an email every month from them telling me what my risk status is, low, medium, high. And I'm always hoping it's low, and it has been low, so that's good. But actually, to tell you the truth, my wife and I opened up a new bank account with Wells Fargo, like a month ago. And I got an email from them asking me if I opened up this account. If I didn't, let them know. So they monitor, and there's firsthand experience there. So anyway, I just wanted to mention that as well. Questions? I know I went through it really fast. Okay. Like I said, my card's in there. If you have come up with a question or later, feel free to email me or give me a call.